With that, recently, to educate more New Yorkers and reach out to concerned Asian communities of the country, the Center for Community Media held a panel discussion titled Coronavirus and New York City's Chinese Community, Disinformation, Discrimination, and What to Expect. This event comes during a time where the outbreak, which has seen no cases reported in New York so far, is adversely impacting Chinese and other Asian community businesses. The discussion also reflected upon the measures being taken to protect the city of New York, along with more on virus threat, preventative measures, and the state of city hospitals and its capacity in case of a local breakout.
I'm Rong Xiaoqing. I'm a reporter for Xingtao Daily. I'm the moderator for today's panel, and today we talked about the coronavirus epidemic, which scared a lot of people around the world. It seems like we don't have confirmed case in New York City, and the city hospitals are quite prepared. But we don't know what would happen in the future. There could be a bigger outbreak, so everyone needs to embrace and to be prepared for a future epidemic.
That is obviously ongoing. There's always this contingent of misinformation. So from a public health standpoint, we are always battling two outbreaks. First, the actual outbreak of patients getting infected, and then this outbreak of this misinformation being, populated by, fear mongers and whatnot. And it's important to obviously be able to give factual information. So from the census standpoint, it'll give an opportunity for public health officials to perhaps give pamphlets that have factual information of what is actually happening and what they can do about it. So I think from that standpoint, certainly, things to plan for, but we're not there yet, and, we can certainly look and see what needs to be done in that regard.
Yeah, I'm Dr. Sarah Mundad. I'm the Senior Director of New York City Health and Hospital System-Wide Special Pathogens Program. And we're here today to basically talk about, the coronavirus disease and how not to obviously stigmatize or discriminate against the Asian community. Obviously, there's a lot of interest in this particular topic given the context of what's happening around the world. There's obviously a coronavirus disease outbreak happening with over, 75,000 cases and counting. But one of the things we want to highlight is obviously not discriminating against any particular community. So in this regard, the Asian community, what we know is that infectious diseases do not respect boundaries. Everybody's susceptible. And so obviously just making sure that, discrimination is not something that, is, based on science, if you will. So look at facts, look at things that are coming out that are factual, and obviously talk to your healthcare provider if you have additional information or have additional questions.
Obviously their business has really been suffering, and I'm wondering if you're seeing any more, or if, I feel like it would be very problematic for lots of businesses to somehow mark that their establishments were safe, but are you seeing more of this? Is there something that we as journalists can help with that and the sort of disinformation around that?
So while this may have started in China, that doesn't mean that none of us are, are not susceptible. It can obviously spread to anybody. So from that point on, we need to obviously make sure that we are not stigmatizing or marginalizing any one group of people. Because also from a public health standpoint, what this does is that if you're marginalizing and discriminating against a group of individuals, then those individuals are less reluctant to actually seek out healthcare assistance because of being marginalized. And what that does from a public health standpoint is that then that chain of transmission can continue.
That is so important a point. That's why we need your help to get out the message. The best message is from you as journalists, independent professional journalism that does the fact checking, right? The example, you want to encourage transparency. You want to encourage honest reporting. If something, I have a model and all my staff knows it like a broken record. If there's bad news, I want to be first to know about it. But I hate surprises. So if you're honest with me, you gain trust. If I lie to you, then you cannot trust me.
It's very unfortunate that this time around the coronavirus is creating such a negative impact in our community. But there is no case that's been test positive in New York City and New York State at this moment. There are 0 cases as of today. And the mortality rate at this moment is 2%. So even if you're infected at this moment, 97 other person do not die from it. And so, knock on wood, obviously, we hope to have it safe. So we are also doing a campaign called Show Love here, which is that if you come between now and between Valentine's Day and March 15, any receipt about $10, you can go to our kiosk and redeem for a raffle, and you can win an iPhone X, some jewelry, and something. But more importantly, I know many of you came down to Chinatown without redeeming the receipt or going to the raffles, but we really gratefully appreciate that because I see that this campaign is being copied by other cities, other mayors. San Francisco mayor just showed some love today by going to their local Chinatown store. Philadelphia mayor went to eat in Chinatown, and our health commissioner came, Dr. Babo, took her team twice to eat in Chinatown. So I encourage people to, you have a higher chance of getting the flu if you don't take the flu shot, keeping wash your hand, but the chance of getting the coronavirus is very, very remote at this moment, but we should stay vigilant. But at this moment, life goes on. Enjoy life. There are a lot of great fun and great food and great company to be had in Chinatown, and I hope to see you there soon. Thank you very much.
Hi, I am Ayako Takada from NHK, which is a Japanese broadcaster. And I wanted to add to this question, this discussion today, that because we look like Chinese people as well, we really feel for them, and I feel we experience the same thing. So we wish that more like accurate information will go around, and we can, all the media, not only ethnic media, but major media are going to talk about this.